Welcome back to the Best PT Podcast. This is episode 6.1, the metabolic system. Functions of the metabolic system. Governs all the chemical and physical changes within the body. Generates energy for all bodily processes. Involves anabolism, or combining simple molecules into complex ones, and catabolism, breaking down complex molecules into simple ones. Metabolic pathology. Inherited disorders include phenylketonuria or PKU. The cause is the elevation of serum phenylalanine greater than 6 milligrams per deciliter in the blood. Signs and symptoms include severe cognitive impairments if untreated, gait disturbances, hyperactivity, psychosis, and an abnormal body odor. Treatment involves the dietary restriction of all phenylalanine, which will alleviate all symptoms. Phenylalanine is found in soybeans, egg whites, shrimp, chicken, fish, nuts, turkey, cottage cheese, and aspartame, so things like diet soda have warnings on them that they contain phenylalanine. Sachs Disease is a genetic disease, causes missing developmental milestones after 6 months, mental impairments, paralysis, and usually death by age 5. Currently no treatment. The main way to detect Tay-Sachs disease is genetic testing of those, especially those with Eastern European Jewish heritage. Mitochondrial disorders are caused by DNA mutations that lead to impaired protein function within the cellular mitochondria. Signs and symptoms include muscle incoordination and muscle weakness, visual and auditory impairments, learning impairments, heart, liver, and kidney disease, respiratory, neurological, and GI disorders, and dementia. Treatment involves symptom alleviation. Wilson's disease is a defect in the ability to metabolize copper. Signs and symptoms include copper rings surrounding the iris of the eyes, basal ganglia degeneration, liver damage, ataxia, fractures, and muscle atrophy. Treatment involves vitamin D6 and D-penicillamine to promote copper removal. Acid-base disorders, metabolic alkalosis, is an increase in bicarbonate accumulation or abnormal loss of body acids, such as excess antacid consumption. Signs and symptoms include vomiting, diarrhea, confusion, muscle cramps, paresthesia, and hypoventilation. Treatment includes electrolyte balancing and potassium chloride supplementation. Metabolic acidosis is the accumulation of acids or loss of bicarbonate, usually due to kidney failure, lactic acidosis, diabetic ketoacidosis, or alcoholic ketoacidosis. Signs and symptoms include hyperventilation, vomiting, diarrhea, headache, weakness, hyperkalemia, and cardiac arrhythmias. Treatment involves electrolyte balancing and sodium bicarbonate supplementation. Metabolic bone diseases. Osteomalacia is caused by a calcium or phosphorus deficiency, resulting in soft bones, a vague feeling of aching, fatigue, weight loss, and lower extremity bowing of the bones. Treatment involves increased nutrition and weight-bearing activities. Osteoporosis is a decrease in the bone mass of the trabecular and cortical bones. Signs and symptoms include compression fractures, lower thoracic or lumbar pain, loss of lumbar lordosis, dowager's hump in the cervical spine, and a decrease in overall height. Treatment includes vitamin and pharmaceutical supplementation, assistive device prescription, patient education, and exercise. And Paget's disease is a heightened osteoclastic activity. Signs and symptoms include musculoskeletal pain, bone deformities such as coxivarus and genu varus, headache, vertigo, hearing loss, cognitive impairment, fatigue, and heart failure. Treatment involves bisphosphonate drugs to stop bone resorption, exercise, and weight control. That's it for episode 6.1 of the metabolic system. Episode 6.2, we'll talk about the endocrine system. As always, the outline will be in the show notes. Thanks for joining.